Hello everyone, this is Dr. J and welcome back to the channel. This first case is a Q-tipping dilemma, but if you stick it out till case number 3 and watch till the end, you'll see the Cannonball wax plug. He actually had it in both ears. One was a little bigger than the other ear, but stick it out to the end so we can watch that one. I promise it'll be something worth waiting for. Now, this first patient had been using Q-tips for a long period of time, and they came into me with hearing loss. And when you look in the ear canal was completely obstructed with large wax plugs, and they both had a concavity or an impression on the front surface of them that was consistent with Q-tipping or cotton bud use on a regular basis. Now, these patients usually wind up using their Q-tips or cotton buds every morning or after every shower, and it tends to pull wax and push wax from the front part of the ear canal into the deeper parts of the ear canal. And that's exactly what had happened with this patient. There we see a normal looking eardrum after the wax plug was removed. It came out in one whole piece. Let's move on to the left ear, and you look inside, very similar finding. You see a concavity and like the wax has been kind of mushed and plastered against the canal walls. So utilizing the right angle, we gently lift it up off of the ear canal wall, apply some Colace, and get a little bit of lubrication between the ear canal wall and the wax plug. And once that's done, these usually come out with just a little manipulation, and then, patient's talking to me there, and that's why it's moving a little bit under the microscope. Once you're able to get that Colace in between the plug and the ear canal wall, any sort of lubrication, it tends to come out much easier and in one whole piece. And here comes this one here, a little bit of fragmentation, but this will come out in one big piece as well. And when you look at this plug, once it comes out, you're going to see, again, that concavity. You're going to see that impression of a Q-tip on that front surface. It's a very classic finding. And a normal eardrum. Here we move on to case number 2. This was a young child who was tolerant of me getting in their ear and performing this procedure. They had had an event where there was some trauma to the ear, and I don't remember exactly what that trauma was, but the result of that trauma was that they bled a little bit into the ear. And as you see here, what you're looking at, the darker area is old blood, like an old blood scab. And in the ear, when the blood dries out, it becomes very hard and rigid. Almost, I would compare it to maybe some obsidian, if that makes sense. It can be kind of sharp all along the edges, and it loves to hold its shape. It's not very moldable like a wax plug is. And this was interfering with his hearing and was causing some discomfort. Now, initially, I tried to go in with some suction, and this child wouldn't let me. So I went in with just instrumentation, gently lifted that up with a right angle, and then pulled it out with the alligator forceps. Now, here we are. We've got a little wax plug, but you've still got some cerumen attachment to the canal wall, and it's really stuck. So just trying to lift up that base of where this wax plug is attached. And if we can get that, then I'm pretty sure all of his symptoms will resolve. So I took a little bit of time here, and I fast forwarded this a little bit, and we're really moving sub-millimeters here when we're working on that area because we're so far in the canal in the kid's ear. And sometimes they can jump and move around, but I was really impressed with this kid. He did not move around a whole lot. And then I used the smallest suction I have, number 3, Fraser, and it doesn't generate as much noise as the bigger sections. And got that last piece out, and the kid held still for the entire procedure, and no more problems. Everything looks healthy now. Okay, case number 3. This is the one we've been waiting for. This patient came to me for, again, hearing loss. These wax plugs were very symmetrical, meaning they both had the shape of a sphere, which is very odd. I don't recall having this happen before, where you have a sphere-shaped wax plug. And he had not been manipulating his ears. He had not been using any drops. He didn't do anything that would promote having this kind of odd spherical shape to his wax plugs. And on this first ear here, as soon as you get in, I see that it's a hard plug. I immediately go ahead and apply some co-lace and just start to manipulate it. And it's moving fairly easily. And so I know I called this the Cannonball wax plug. This side's more of a musket ball. A musket meaning a black powder rifle, and it's just a kind of a smaller sphere than what we saw on the other side. And just getting it wouldn't come out with the suction, and so I grabbed the right angle and just able to tease it out. And so here's what we'll call the musket ball wax plug. Nice little spherical shape. The cerumen impaction didn't go any deeper than that. There was just a little bit of cleanup here out front, and that was it. He had a otherwise normal ear canal. Just a little more touch up here with some suction. There we go. And just a little bit there. A little loose skin, a little cerumen, and a little bit of a skin ribbon. And now a normal ear canal. All right, moving on to the Cannonball. This is his right ear, same patient. And as you get in, now I'm using the largest speculum I have. This is actually an operating speculum, meaning that we can do surgical procedures through this. It's the exact size of his ear canal. So my normal speculums are much smaller than this that I use on the channel. This is the actual size of his ear canal. And you can see here it fills up the entire ear canal. And I immediately started with the co-lace and started trying to manipulate this plug. It's not moving as easily as we did on the other side. So we grab the right angle and just start to pull on it a little bit and try to roll it out. But because of its sphere shape, it just kind of rolls in place. The bottleneck portion of the ear canal, we're trying to get it through that bottleneck portion. So we're trying to take something that's larger than that bottleneck and pull it through the bottleneck. So the ear canal is wider than the actual outer part of the ear canal. It's kind of like giving birth. It's got to dilate just a little bit to allow that plug to come out. And here we go. We got the plug into that bottleneck, and now we're just going to tease it out of that bottleneck, and there it comes. There's the Cannonball. Again, I've never seen someone with bilateral spherical wax plugs like this before. Very odd presentation, but it came out fairly easily and fairly quickly. I did not edit much out of this process, so this was a very satisfied patient. Didn't take long to get his hearing back, and there goes the Cannonball. And then behind it was a normal ear canal. And thanks for sticking out to the end. Thank you so much for all the comments on the last video and my pilot voice. Stay tuned. We'll see you on the next video. Thanks for watching.